Hello everyone, I'm Huan Chen, the first author of the study titled Evaluating Anchorage and Torque Control in Adolescent Patients with Class 2 Division 1 malocclusion among 3 appliances. My co-corresponding authors are Guangyin Song and Bin Han, and I'd like to give a special introduction to Professor Tianmin Xu, the inventor of the past appliances. Now let's talk about our focus. You see, adolescent patients with maxillary protrusion and mandibular retraction really needs to get anchorage and torque control perfectly to improve their facial aesthetics. And as orthodontists, we are always on the lookout for the best way to do that. Now there are 3 main appliances in our practice. Each of these has its own unique way of controlling anchorage and its own bracket designs. But we don't really know yet if they all lead to similar treatment outcome. So we aim to compare the anchorage and torque control of the 3 appliances. To do this, we carefully selected a sample of 90 adolescent patients, all with angle class 2 division 1 malocclusion, and in need of maximal anchorage in the maxilla. We superimposed the pre-treatment and post-treatment litrocephalograms, as well as the maxillary 3-dimensional digital models to analyze the differences in anchorage and torque control. Among the measurement variables assessed in this study, statistical differences was observed in the mesial displacements of maxillary first molars, the incisor retraction, and the torque variation of the maxillary central incisors among the 3 groups. In conclusion, the treated device has superiority pertaining to molar anchorage control. The path without any auxiliary devices could make full use of the physiological anchorage. The differences of torque control varies depending on the respective characteristics of bracket designs. In the future, we will embark on a prospective randomized control studies to delve into the quantitative relationship between lowering the compensation curve and the loss of anchorage. You see, in adolescents with a more pronounced culture of the compensation curve, when we insert a strand wire into the brackets, it has this effect of lowering the occlusion curve. But along with that, it also causes the anchorage molars to tip mesially, and this greatly increases the risk of losing that all-important anchorage. So we are going to study this, quantify it, and see just how these 2 factors are interconnected.